So today, the injury I'm going to be talking about is an avulsion fracture, particularly found in the hip. So an avulsion fracture is basically when a muscle tightens very quickly and pulls a piece of the hip bone off, in this case the hip bone. It is typically found in younger adults where the growth plate is still not completely sealed. So the hip, like in this area, there's a growth plate here, right around the ASIS, and the piece of the muscle, or a muscle, will contract very quickly, like say during a soccer shot or something. The muscle will contract and literally yank a piece of the hip bone off right where the growth plate is. So some three bony landmarks that correlate with with an avulsion fracture in the hip is the ASIS. So you go in onto either side of the hip, and then you find the bony prominence, which is right in this area. And this is where quite a few of the avulsion fractures happen. Another place, same place, but then you go a little further in, and that's the AIIS. And right here is another little bony prominence just below the ASIS. And then another bony prominence is the ischial tuberosity. You can't palpate it here because it is quite deep set within the hips, but that is also a very common point of an avulsion fracture. So three soft tissue structures that correlate are the sartorius. So it inserts at the ASIS and goes all the way down the leg, and you can palpate it all the way to almost the inside of the knee. Then another one is the rectus femoris, and you can feel it, the very big muscle straight down the middle of the leg. Then on another place is the hamstring attachment. So the hamstring attaches in the back of the knee, or in the back of the leg, and it attaches to almost just to part of the hips that are at the back. You can't palpate that area of the hip, but you can palpate the hamstring muscles on the back. So two examples of treatment are one, surgery, but that is when the case of the avulsion fracture is quite severe. Another one is immobilization of the leg completely, and then the use of crutches without the use of the leg. So almost complete immobilization of the leg. So one example of long-term treatment would be stretching. Stretching of the hip flexors in particular, both legs, and then also stretching of the quadriceps muscles, especially the rectus femoris, to avoid the pulling of the large muscle in the leg. Also, stretching of the hamstring muscles in the back to reduce the tension in both legs. So another example of long-term treatment is muscle building, especially in the core area. One such exercise that could be done to strengthen the core a lot is a Russian twist. This is done by having a weighted ball or dumbbell and twisting from side to side, thus strengthening the obliques and the abdominal muscles as a whole. Another exercise that can be used to help support the hips is lunges. This particular exercise helps strengthen the quadriceps muscles, especially the rectus femoris muscles, which helps support the movement of the hips as a whole. So for the first bony landmark, I'm going to find three of the knee. So for the first one, I'm going to find the tibial tuberosity. To find the tibial tuberosity, you have to go up the knee with the shin bone, which is here, the tibia, and then you find a little bony prominence just below where the kneecap is. So here's the kneecap. You come down and you find the tibial tuberosity here. So that's just a little bony prominence right in this area. Next, I want to find the medial condyle of the femur. So that's on the medial area aspect of the leg. So I go up from the tibial tuberosity, find the joint line, which is along here. Then from here, I'll go up to the medial area along the joint line, up, and then right in here is the medial head of the femur. Go ahead and mark that there. You can see it on here. So here's the medial head of the femur. Next, I want to find the tibiofibular joint. So I'm going to rotate this a little bit. So from here, you have to find the fibular head. So you can palpate. You can't really find the fibula here because of how big the calf muscle and other muscles on the outside of the leg are. So you go up, and then you can typically find the head of the fibula just to the right and off to the right of the tibia. So here's the tibia, and here's the joint line again, and then down, here's the head of the fibula right here, and you can find the tibiofibular joint right in here. If you push hard enough, you can actually feel the fibula moving a little bit off to the side with the pressure that you're applying. So again, right in here is where the tibiofibular joint is. So I'll go ahead and mark that as well. Just to go over it again, I have the tibial tuberosity along the front of the knee, and then I have on this side, along the joint line and then up a little bit, the medial head of the femur. And then on the outside of the leg, I have the tibiofibular joint, which is right in this area. And you can push and feel the fibula flexing very little bit with the pressure being applied. So as far as the ankle goes, 3 bony landmarks that are quite easily found on the foot or ankle area. So here's the ankle area here. If you go down to find the navicular, you go down the side and there's a bony prominence just on the side inside of the foot, almost instep area. So right in this area, you can feel it's all smooth here and kind of smooth above, but then there's that one little bony prominence here that is the navicular. So I'll mark it in that area right there. And then next is the talus. I'll rotate this way a little bit. So the next one is the talus, which is right where basically the tibia connects to the ankle. So if you go into the foot when it's relaxed, you push in hard enough, not too hard, but you can feel the smooth area of the talus right in this area here. So I'll go ahead and mark that there. Then next would be the base of the 5th metatarsal, easily found. So you go, here's the 5th metatarsal, or 5th pinky toes here. So you go out down the side of it, and just when the 5th metatarsal goes in almost, there's a little point right along here. It can be felt quite easily. Go in here and just mark it. So that's where the base of the toe is, right in that area. So again, just to do this again, have the navicular, the bony prominence on the instep of the foot. Then you have the talus, which is right in here. You have to push a little harder, palpate a little harder than normal. And then on the outside of the foot, the base of the 5th metatarsal. You run it from the pinky toe to the base of the 5th metatarsal. It's a bony prominence in that area.